With passive range of motion of the spine, we're going to begin with rotation. We start with rotation because our client is already in this position, sitting on the side of the table, which is exactly what we need to stabilize the pelvis. So to start with, if you would, just put your hands back up on your shoulders, just like that. Now we are going to be getting quite close to our client during this motion, so make sure they're aware of that. I'll take my left hand and reach across to his right side because we'll be rotating to the left. My right hand goes on the other shoulder, and then I rotate towards myself. And once I reach the end of the motion, I apply a little bit of overpressure and move back. Please note the direction that I'm facing. I'm looking away. When we get this close to our client, if we're looking at their face and making eye contact, it gets a little bit uncomfortable. We do, of course, want to make sure that we're looking at their expression, but in this case, it's best to have your head pointed away. So now to move to this side, we'll do the exact opposite. And turning away, we'll turn the body towards me, and then end feel. And then back to neutral, and you can relax those arms. Now we need to move into a laying position. Moving now into passive lateral flexion. We have our client lying in a supine position. I'll move to the bottom of the table, and instead of moving the upper body in relation to the lower, we'll move the lower in relation to the upper. The idea is the same, which is to create that lateral flexion of the spine. So moving the body as much as we can comfortably to the right, then going back to neutral, and moving the body as much as we can comfortably to the left. Note, though, that I'm not performing overpressure. If I do so, we have a tendency to rotate the spine. Now, admittedly, performing lateral flexion in a supine position doesn't stress the inner tissues to the extent that we would like, but it does give us the ability to see, to a certain degree, how much lateral flexion they have passively. Now, we do not perform passive flexion or extension of the back, largely because it's just too difficult. For me, to grab onto Tim's upper body and bring him passively into a flexed position and then apply overpressure, it's very hard to isolate specifically the inner tissues of the spine, and the same goes for extension. So with that, let's now move on to resisted range of motion of the spine. Hey, thanks for watching, and don't forget to subscribe. If you would like to learn more about orthopedic assessment, click the link in the description below and register for a free training on orthopedic assessment, where I'll take you through my entire assessment process beginning to end, step by step, and teach you my 3 secrets to get more out of every session with my clients. I'll see you there.